Everyone. We are starting our broadcast for tonight. We have Dr. Vapiwala, who's going to present on applying to radiation oncology, a program director's perspective. Dr. Vapiwala is an associate professor at University of Pennsylvania, vice chair of education for the Department of Radiation Oncology, and is an advisory dean for the Perelman School of Medicine, and currently the president of ADROP. So we appreciate that she is spending some time with us today, and we hope that you guys are get something out of this. In general, she'll go over some questions that we've compiled, and it's kind of an informal session. But we request that questions can be added in the last around 10 minutes of the presentation. So I will hand it over to Dr. Vapiwala.
Great, thank you, Karna, and I would like to thank all the organizers for inviting me to this webinar, and also, most importantly, to all of you that have called in and taken the time to join us for the next hour. I'm hopeful that I'll be able to at least shed some light on this whole very confusing, sometimes intimidating, sometimes overwhelming process, but I hope along the way, as you go through the match process and one step closer to your future career, that that some of it can be an opportunity to meet new folks, meet future colleagues, and hopefully enjoy some of the experience as you go. So, you know, with that sort of philosophical overview, I think that it is important to have some detail, to have some facts behind the process, because while a lot of people will offer, you know, generally positive and well-intended advice, sometimes it's nice to just know what are the numbers, what are the data, what are the programs looking for. So I'll try to do my best to provide you certainly my own experience as a program director, as well as my perspective as the current president of the Association of Program Directors. Also, my perspective as somebody who has counseled medical students in my advisory dean role for not just radiation oncology, but many other specialties. So with that being said, we organized the questions that had been submitted sort of as steps along the way through the process. So let's take a look a little bit at pre-application and some of the considerations that go into sort of the steps leading up to your decision to apply. And one of the questions we do get pertains to folks that are not graduating from a U.S. medical school, or alternatively are not graduating from a traditional allopathic medical school. So they've graduated with their doctor of osteopathy degree from an osteopathic school, or foreign medical graduates, the abbreviation FMG here. And then also, even amongst the U.S. graduates, how does one improve one's chances of matching in radiation oncology? So obviously this is a hefty question. And I think over the course of the hour we will address a lot of these points, but I do want to just point out that just this past year, the National Residency Match Program, abbreviated NRMP, had its biggest year to date. When you think about just the sheer number of people that applied through the NRMP for a residency position in the United States, over 42,000 that registered and went through the match for just under 31,000 actual positions. And interestingly, the number of medical school seniors coming out of the traditional U.S. allopathic schools went up 221 to just over 18,000. And that's probably reflecting the fact that there are new medical schools, and some medical schools have increased the size of their classes. And so, you know, in any given year, you might have a greater number graduating. Interestingly, the number of first-year positions, so PGY1, which, you know, for a program like radiation oncology where you first have to do an internship, it doesn't directly reflect on radiation oncology, but it is important to know that in terms of available first-year residency positions, internships, those also rose by about 567. And so the majority of the increase in terms of both applicants and positions is really coming from primary care positions, so family practice, internal medicine, pediatrics. You know, it should not be surprising that in the past 3-4 years that's what we're seeing, because with the changes in healthcare and the anticipated need for a greater number of primary care folks, you know, that's to be expected. that we will need to train more primary care folks and that more folks will apply in those specialties. So it's important to know that for Rad Onc, although there are some increases in our available positions, we're not going to ever have the types of increases you would see for internal medicine or pediatrics. It is still relatively tightly controlled, and I do also have a role on the ACGME. I sit on the Residency Review Committee, and we do try to be very judicious about the number of, of training slots that are out there in terms of educational quality being our top mission. And if you look at Rad Onc Match, we fill all available first-year positions. There are none left over to spare. And I think dermatology, orthopedic surgery, and vascular surgery are the only other ones where it's essentially that way. And if you look at the numbers, basically in 2014, there were 1.2 applicants per position. So obviously, this is a little bit of a difficult statistic because there's not going to be 0.2 of a person. But if you do the math, bottom line, there are more people applying than there are spots. And so we have an unmatched rate. And if you look at U.S. medical school grads, it's about 11% of U.S. medical school grads who will not match in Rad Onc, who intended to, for whom that was their primary choice. And if you look at everyone else, so that's DOs and foreign medical graduates, 2/3 of those applicants did not match in Rad Onc. So they're intimidating numbers in that regard. But in the end, overall, those that do apply seem to have really thought through that process. So in the pre-application phase, I guess my advice would be make sure you have good counseling either at your home institution or other folks whom you can call upon to really look at your overall CV, to look at you as an applicant, and to give you honest feedback about your chances, because I think that's probably a much better use of your time than going through the process with sort of a false sense of where you stand. And I think that is just a theme throughout this talk, is to make sure that you do get somebody to vet you up front and hopefully get that good mentorship if you can close to home. Interestingly, less than a quarter are actually AOA members. If you think about honor society and things like that, for whatever reason in 2014, Rad Onc did not have an overabundance of folks that were AOA members per se. But if you look at medical schools and sort of where medical schools rank in terms of NIH funding and their sense of mission for research, almost half of Rad Onc applicants came from one of those top 40 schools, for whatever that's worth. I think that this is just in terms of across the board trends in the United States for allopathic and osteopathic applicants, as well as, if you look here, foreign, or as abbreviated here, international medical school graduates. And the takeaway here, I'm not going to belabor the point, but just in the past 12, 13 years, from 2002 to 2015, there are a growing number of applicants from osteopathic schools and from abroad who do well in the match. Again, this is not representing Rad Onc alone, this is everyone. So the majority of these bumps and improvements in non-U.S. allopathic students is really coming from, again, internal medicine and pediatrics. So for Rad Onc, it kind of remains stable. Now, if you are an international medical graduate and you're really serious about applying here, just so you know, the general factors associated with a successful match for international graduates, ranking more programs may sound obvious, but again, being very sort of liberal with your rank list and not being overly picky geographically or in terms of prestige of the program. Higher USMLE scores, certainly. Fewer attempts at the certification exams that are taken by the foreign medical graduates. If you already have U.S. citizenship and or speak English as a native language, those are certainly associated with a successful match outcome. And then finally, having some proximity to when you graduated from medical school. For folks that are really non-traditional students, if you're coming out of a U.S. medical school and you're non-traditional, that can often be seen as a strength. But if you're coming from a foreign medical school, and this includes even Canada, training, and your sort of pre-career counselors about, in general, if you can do it during medical school, it sometimes carries the appeal of still leaving you some time to do clinical work before you graduate and enter internship and residency. That can generally be seen as a strength because you're still part of a school, you're still part of a program, you have student status, you have the ability to brush up on your clinical skills. I think that's when most folks do have the most success in performing a research year. That's not to say you can't do it after graduating, but it does call into question if there's a reason for you delaying, if there's something that you're trying to compensate for as opposed to true interest in research. So I would say, if possible, if you can do it in between your third and fourth year, where you still leave some clinical rotations, not the most critical ones, but you still leave some for after your research year, that can generally be a strength in the long run, not necessarily for application, but for you as a physician and for your clinical skills. If you do complete a research year, I have to say I think that most of us who are program directors who look at your application will absolutely expect something out of that year. And it doesn't have to be quantity, certainly, but either some sort of high impact or meaningful contribution that directly relates to the research you did during your year, and or perhaps several smaller papers that come out of that year, or perhaps wrapping up projects that you had previously, and then possibly some of your existing research is on its way to being published. Maybe it's not published yet, but it gives you something to talk about when you interview. There needs to be some progress for that year. And furthermore, if you do a research year out, you're definitely going to need a letter from your mentor or primary mentors during that year that is strong, because it speaks to your performance during that year. And those will be the people that know you best at that point. In terms of, if I just mentioned multiple times getting advice and counseling, ideally from someone who knows you, but I do sympathize that a lot of folks have institutions where they don't have easy access to someone who's familiar with radiation oncology, or maybe even that familiar with you. And that can be a challenge. And I do think that to help you in your process, thankfully in today's world and in our specialty, which is relatively small, you can make connections with faculty from other institutions. You can make connections with residents and medical students from other institutions, and hopefully draw from them whatever advice you can. You can certainly do away rotations. We'll talk more about that in a few slides, but if you do an away rotation and can make some connections, or at least sit down with the program director when you're at that institution to get some advice and make a connection, those folks can continue to hopefully serve as a source of advice for you. I think there isn't much you can do beyond that. You can still get some general counseling, of course, but I think if you need a break, so to speak, or a way to make that connection, even through organizations like ACRO or through ARO, I think you should not hesitate to reach out to existing Rad Onc residents or other medical students, your peers, to try to connect with someone, whether it be myself, now that you've participated in this webinar, or any of the folks that play a role in the Rad Onc residency program at some programs that you might be interested in. I think there's a subtle way to do it that isn't taking up people's time, but I think there's a thoughtfulness that goes into making those connections and recognizing, look, I don't have someone to guide me, could you please help? I think the vast majority of us are very willing to do that for people who don't have the access at home. We are sympathetic to that. And so away rotations certainly have become, for better or for worse, a normal part of this process. And as far as recommendations, I used to tell folks you really need to spend medical school learning medicine and doing as much of your medical electives and time in radiology, pathology, cardiology, infectious disease, all of the things you can do. But unfortunately, the reality is that the vast majority of folks do away rotations, and on average they probably do about 2 or 3 away rotations in various states throughout the country. And so my only recommendation is, again, that you strongly consider where you apply for away rotations. Make sure they're places that you want to be at, but are in a position and in a frame of mind to excel when you're there. You don't want to do it when you're stressed out about your sub-internship, or you don't want to do it when you're, who knows if there's something going on in terms of your personal life and it's not really the best time of year for you to be away. You kind of really, if you're going to go there, you need to bring your A game, and I think that that's the, the double-edged sword of doing an away rotation, is you are taking on the responsibility of sort of leaving them with the best possible impression, and that is, sometimes going to work against some people. So my recommendation would be think carefully about the places you want to go. Think carefully about the timing of that relative to your other rotations. If there is a home institution rotation, try to do that first so you have something under your belt. So you have some experience. Generally, your home institution, which knows you and supports you, will be a great first Rad Onc experience. You'll want to have done, obviously, as much of your other rotations as possible, just so you're comfortable with learning how to present patients. So you have some background on Rad Onc. You're not completely novice to it. I think there's nothing worse than doing an away rotation and really sort of being very much at a disadvantage because you've never done Rad Onc before or have had very limited exposure. It becomes a difficult point to convince people on of why you're committed to it if you seem like you're just a little too green to it. And I think that what you work on or study, I do have a list of references that you can use to prepare. But I think to make a great impression during away rotations, you kind of need to do the same thing you did through all of your required clerkships. You need to show enthusiasm. You need to show that you're part of the team, that you're invested. It doesn't mean you'll have every answer. Why would you? But that you're willing to look for the answers, that you show initiative, that you support your resident whom you're paired with, or if there's another medical student there with you, that you're collegial. People are looking for that, and they're looking and observing how you are and how you interact with the other students that are also doing an away rotation. They look to see how you treat the residents, the faculty, at least I do, how you treat the support staff. As much as, of course, we're looking at your knowledge base. And no one should be expecting you, fairly speaking, no one should be expecting you to have some complex treatment planning knowledge. I think what you need to be able to do is succinctly present patients. The same thing you needed to do on medicine, the same thing you needed to do on surgery. Now, obviously, with a cancer patient in mind, but if you do well on that and you really, are able to participate on the team and with the help of your resident and whoever else is orienting you to the rotation, make sure that you have access to the electronic medical record, make sure you read up on the patients that you're going to see, even if you think they're not the ones you're going to necessarily have to cover or see with your attending. Try to make sure that you have a game plan of exactly what you're responsible for, and try to knock it out of the park in terms of your interaction with the patient, presenting the patient to the resident and the attending, because you do have that first impression goes a long way. And for a lot of rotations, not at Penn, but for a lot of rotations, you might only see an attending one day or maybe a couple of days, and it's a round robin. And those folks will later weigh in. And so that, again, that first impression is it's a high stakes but potentially very high reward environment, I would say. So be aware of that. And these are just some ideas I have of realistic things that you would want to know. I mean, no one's expecting you to have quoted every bit of literature out there, but I think you can access up to date. What's nice about that is wherever you are, you might want to quickly look up a certain diagnosis or just have the basic background there, and obviously that's nice because you can access it online. And certainly staging is important, some of the basics of just being able to help with staging. That's easy pinpoint questions that you might get posed. And NCCN guidelines are a great resource because they have background on why patients might be managed a certain way. So if you have a patient you're working up, you know their diagnosis, you can sort of try to think through the assessment and the plan using some of these guidelines. And then just for the basic principles, your good old classic textbook, the DaVita, I'm not saying you need to, peruse this cover to cover, but you just need to be aware of this resource for those that, truly want more in-depth background in oncology in general, not Rad Onc specific. And then just some, classic handbooks, the Hansen and the Hafty are two that come to mind that can fit in your pocket and might be good resources for you. And just as with any rotation, it's fine and great to occupy yourself when there's downtime. You don't want to be seen, hovering on the computer or reading your book when there's something going on with the team that you could be helping with, obviously. So be judicious about when you're catching up on notes or catching up on your reading and when you're interacting with the team. Again, first impressions are critical. So moving on to the actual application, we picked out some questions that people had submitted. One question was about, red flags. When would you tell a medical student not to apply? What are common mistakes on the application interviews? I mean, I think this is not Rad Onc specific. I think that the latter question is really just, common mistakes can be sort of not being prepared to answer questions about your interests and your motivations for radiation oncology, not being familiar with your research that you listed, or even perhaps some hobbies that you listed, or some volunteering experience that you listed. Anything in your ERAS application, your electronic residency application, is fair game, and a lot of us will really peruse those, and we might ask you about something that's relatively obscure. So, you don't want to put anything on that application that you're not ready to talk about, and particularly for the research. I think the most common mistakes I see are either sort of not being able to succinctly but meaningfully describe research that you've participated in. And we're not going to ask you about things that you're, buried in the middle. But if you're a first author on something, or you presented an abstract, you really should be able to cogently explain the research. And I think that another common mistake is, unfortunately, coming into the interview with sort of a, believe it or not, either seeming unenthusiastic or perhaps tired. And this is tough. You guys are going to be flying back to back. You might be coming off a red eye, going from one end of the country to another. When you actually get into the interview process, it can be very taxing. But if you come in and sort of it's low energy coming off of you, I can tell you the interviewer is going to sense that within a second, and in turn, essentially our energy gets sapped by that. And it's very hard to get through a 20-minute, 30-minute interview with someone when you sense that enthusiasm isn't there. So I'm not saying go crazy on Red Bull or Mountain Dew or overdo it, but I do think you need to have that A game on, and that smile and that firm handshake, and be as enthusiastic in that last interview of the day as you were in the first interview. And if you really want to be there, that energy is going to be critical. And believe it or not, it's a common mistake. I do see folks just sort of withering a little bit. When as far as the first question, I mean, again, this is one where I think as we go through some of the data I'm about to show you about what factors we look at and what factors we don't, I don't want anyone to walk away from here thinking that they have it either have it actually made and are slam dunk, or conversely don't stand a chance. None of this is ultimately a formula. None of it is going to be absolute rules or guidelines that we follow. They are all relative, and there are lots of people with some relative weaknesses that are compensated by other strengths. So I don't know that I can give this kind of advice on a webinar. I do, however, have one-on-one meetings with my students and have these discussions about when it would be best not to apply. And generally speaking, it's because they have multiple areas of weakness, relative weakness in their application that are not going to be easy to compensate, and they don't have the time to spend to remediate those things. So that would be sort of the situation where I would perhaps have them consider an alternative. In terms of step exams, right? So USMLE step exams is a classic thing where I'm going to give you some guidelines and some data, but I don't want anyone here looking at this as a cutoff that means that you don't stand a chance. But just to give you a sense, If you have a low step 1 score, it is possible and actually critical that you take step 2, and it's possible that a strong step 2 score will help to compensate for the low step 1 score, so that at least we see that this may have been a one-off, that this isn't an issue where you have difficulty with examinations. That's where if I see a low step 1 score, I'm looking for a strong step 2 score. Now if you take a step 2 and that's also low, but other things in your application are strong, that's okay. If they're not, that's when I start to look at, well, how they do on their shelf exams, how they do on their clerkships. Do they get a high pass and everything because they always barely pass their shelf exam? And that's where we start to look for a theme of poor test taking. But hopefully if it's just one isolated step score that's low, there are other ways to make up for that. 2 low step scores, step 1 and step 2, hard to come out of unless all your clerkship grades are honors. And then the only thing I would say, if you have a high step 1 score, I would just leave it be and not even take your step 2 until after. We're not looking for it. And if you have a strong step 1 score, I would just deal with step 2 either before graduation if your med school requires it, or shortly after. And I will tell you, exams are not everything, but they really can, again, make that first initial impression on paper, and they can help you get in the door, so to speak. In 2014, and I apologize, I meant to put on here, these are 2014 data. If you look at USMLE Step 1 mean scores for all seniors that were applying from the U.S. allopathic schools, so these are your traditional MDs coming from a U.S. school, it was 230. And then DOs and foreign grads, it was 220. And the minimum passing that year was 192. Rad Onc were 10 points above that for the mean U.S. applicants, and the independents, as you see there, DOs and foreign medical grads were 234 for Rad Onc, whereas they were 220 for all specialties combined. Step 2 mean scores that year, again for U.S. seniors, MDs 242, DOs and foreign medical grads 227 with a minimum passing of 209 that year. Again, Rad Onc higher than the mean for sure. For U.S. seniors 248, for foreign medical grads, significantly higher than the mean 240. So again, this is for that particular year. I'm not saying these are cutoffs, but if the mean is 241 for step 1 from a U.S. allopathic school, you should gauge yourself against that to see where you stand and if you should or shouldn't try taking the step 2 to up your chances. Switching gears to research, is any research enough for my application, or does it have to be Rad Onc specific? And this is where I think that, and this might be my personal viewpoint only, but if we see that you have a tradition of starting a project and seeing it through, that is incredibly meaningful, more than anything. And if it happens to be researched in another area, that's okay, unless it happens to be something so incredibly different from Rad Onc, another medical specialty that you were basically probably going to apply in, or maybe thought to apply in, but then suddenly made a switch to Rad Onc that is not easy to convince. If you don't have a good arc, you don't have a good story about why Rad Onc, and you have 6 publications in ear, nose, and throat, it's not a bad thing, but if they're not cancer related at all, you'll need to just be able to explain why the switch. But I think, bottom line, if you have research that you've done in a non-Rad Onc area and you've seen it through to fruition, and you have a good relationship with that mentor who might even write you a letter, that's totally fine. I do think at some point, in order to be convincing about how that research is just part of your general scholastic and intellectual ability, and still be able to say, but yet I'm interested in Rad Onc without having done any research, you need to have a credible story in your personal statement that says, yes, I've done my research in this or that topic, but I'm interested in cancer and I'm interested in Rad Onc for this reason. And it doesn't have to be that you've done a ton of Rad Onc research. Probably by the time you interview, if you get an interview, you will want to be engaged in perhaps something so that it shows that you are moving that direction. But I would not see that as a detriment unless it is just so far leaning or something not even in medicine that you're going to have to make a convincing argument of why suddenly you're applying in Rad Onc. As far as PhD, only fewer than a quarter of patients, of applicants had a PhD in the 2014 year. Now, it is true that compared to other specialties, including the most competitive specialties out there, so derm, plastics, Rad Onc is up there, we happen to have the highest proportion of folks with another advanced degree relative to those. But if you're looking at just absolute numbers, please do not despair and worry that you need to go out there and immediately acquire a master's or start thinking about your PhD application, because that is by no means the norm or even the rule, and the vast majority of our applicants are still MDs. However, again, getting back to question number one, just because you have a PhD doesn't mean you have a robust PubMed CV. You don't have necessarily the same number of publications as many MDs do. So it's not so much the research degree, but what your general interests have been and what those confer on you as an applicant. And, I don't look at whether or not you have the PhD unless I'm seeing a lot of publications. And then if you have a PhD, I'll say, well, sure, that might have been part of your thesis. That's expected. And if you don't have a PhD, but you've still been pretty productive, that's actually, to me, all the more impressive. So we like having certainly combined degree folks because they bring perspective and depth to any residency class. But I don't know of any program director that sits there and has a quota of PhD students that they're trying to fill. So hopefully that is reassuring to many of you. It's neither a detriment nor, slam dunk. In terms of research, though, I will say, again, there is, for better or for worse, some incredible emphasis on research in our field over the past, I would say, 5 to 10 years, and the mean number of research experiences, and we'll say experiences in air quotes because how you define that is sort of up to the applicant, but it is higher than most of the other, almost all of the other specialties, derm, plastics, ortho, and the mean number of abstracts, presentations, and publications, which is tricky because an abstract is not the same as a true manuscript, and lots of people have abstracts that they don't convert to papers, which is not a good thing to me and to many of us who are looking for people that execute projects, not just start them and don't finish. But if you just pool it all together, it's an insanely high number, considering that these folks haven't really even graduated school yet. So 12.2 for U.S. medical grads, MDs, and then for DO and foreign medical grads, it's pretty much similar. And again, these are 2014 data. I would not despair if you are not near or anywhere near this mean number. This is, to me, I think a reflection of lots of abstracts, a lot of similar projects being presented in multiple different arenas. There are more meetings and conferences than ever before. Students have more and more access to some of these meetings and conferences, so please do not panic when you see these numbers. I do think that having 1, 2, 3 perhaps published papers, if you have 4, 5, 6 abstracts or presentations that you've done is incredibly impressive, because again, we recognize that you have students that are supposed to be in school, and that is your top obligation. And if you happen to be publishing, then something else might be suffering. So I would take these numbers with a grain of salt, but yes, it is true, research helps, and we are looking for it. And if you have no research that you've done and you haven't published anything, there may be other things that you've spent your time in. Maybe you're into things that you've done in the community. Maybe there are experiences, work experiences, life experiences, international medical experiences that you have that you can speak about that that can compensate for that. So again, we do interview folks that have nowhere near this number of research projects. It does not make or break, but it is going to have to be compensated strongly by something else amazing in your application if you totally have nothing going on in the research area. Letters of recommendation. For this first one, I think if I get a letter from somebody with a big name who's well known, well regarded, who doesn't know you, I will tell you that you definitely run the risk of not only a letter that is formulaic, familiar to those of us that are used to reading letters, doesn't make any impression, simply points out that they don't know you, and risks the possibility that they actually put in something in there that isn't really even necessarily true or reflective of you. I would far more prefer somebody who isn't that, quote, bigwig, but who really knows you and can write you something favorable and meaningful with examples, not just platitudes. And I would say that nowadays, if you have a more senior person that maybe co-signs that letter, or you worked with them for a couple of days, but you really worked mainly with the more junior person, it is reasonable to see if their institution likes to do joint letters and co-sign it. I think that's a nice compromise if it's feasible. Otherwise, my bias is to go with the lesser known but more in-depth. Because the bigwig letter where they don't know you, it stands out when it's only a paragraph or two. And believe me, we do get those. In terms of letters of recommendation oncologists in academic settings, generally, yes. But that's not to say that somebody from private practice can write you one. It just has to be, explained what the relationship is, how you know that person, if it's not a friend of your uncle's, that kind of thing. It just needs to be clear why that person would write you a letter and what they know about you. But if that individual in private practice can speak to something different about you than anyone else, sure, that's not gonna be seen as something wrong. You do want to make sure, however, that those individuals in private practice know what to write and are thoughtful about the letter, just simply because they may be out of practice or may have never written one. In terms of interviews, I think when this question is probably just a little too much to even try to cover in one session, but to prepare for an interview, you need to know the place. Sounds obvious, but you need to understand the institution, the program they're in, at least get to know some of the faculty through their, through the website, and some of the names. If you don't certainly want to act like you've done homework and start quizzing or interviewing the interviewer in an attempt to show them that you know who they are, that can work against you sometimes because it can seem not genuine. But I think it is nice to understand what the different roles are of the people with whom you're going to interview or whom you might meet on your interview, and just to understand the culture, the history of the place. Are they an old department? Are they a new department? What technologies are they known for? What research are they known for? I think having some of that background will help a lot. And other than that, try to get a good night's sleep. I cannot tell you how critical that is, if at all possible, even if you're on a red eye. Try to have backup clothes that you can carry on your person. Not so much because we care about what you're wearing, but I think that a lot of you will feel very self-conscious, having been there myself, where if you're not wearing what looks like what everyone else is wearing because your luggage got lost, it can throw you off. And even if everyone else is willing to overlook it, it's important for you to feel as comfortable as you possibly can. And how you're dressed is a critical part of that. Don't overdo it. You don't need to be snazzy. We're not going to remember you because of the tie you wore or what have you, so much as the impression you make in terms of your comfort level and your ability to convey who you are in the limited time you have. And so whatever outfit it is that you need to wear that's respectful and generally subdued, and I hate to say generally boring, is fine, and comfortable shoes so that you're not worn out by the end of the day when you're getting your tour and going to lunch or dinner with the residents. And I think, again, beyond that, most places were not interested in pimping you on Rad Onc knowledge. I think if some places do that, that's not entirely sure that adds any value. And I personally don't believe in that, but I suppose if you've heard through the grapevine that a particular program has someone that likes to ask specific case-based questions, that may be something you want to prepare for. But thankfully, I think that's exquisitely rare. In terms of who we interview, it's a very complicated process. It's very agonizing for us, as much as it is agonizing for you to wait for interview invites. And I can't say that there's a single year where I do or we do the exact same thing every single time. We always take into account nuance. We always take into account individuals who had medical leaves, who had hardships, who had no research but founded a not-for-profit, those things don't fit neatly into any algorithm, and they're not in a spreadsheet, but they matter. However, if you're looking for the facts of what really, in terms of Rad Onc program directors that were surveyed in 2014, top factors that were cited, and about this survey had about a 53% response rate. You figure out a 90-plus program directors, over half of them did submit answers. And the top factors that I could find in this survey in Rad Onc program directors selecting applicants to interview, so I took the cutoff as more than 80% of program directors citing this as a factor. The top ones, in no particular order, rec letters and a specialty. So again, even if they're more junior folks, it's someone who knew you from a Rad Onc rotation, presumably at your home institution, somebody who can vouch for you, who got to know you, rather than a bigwig who met you one day. And if somebody was to call that person and ask them about you, they don't even remember who you are. That's not so helpful. So rec letters in the specialty, your med school performance evaluation or dean's letter, and the summation of what that represents, right? So that's your grades, and a lot of dean's letters have that sort of magic word at the end of where you fall in your class. And a lot of times that might be the general impression we get out of your dean's letters is where did you rank in terms of the rest of your classmates. The Step 1 score, again, was cited by more than 80% of PDs. The research, not with a cutoff in mind, but sort of a penchant for research or the ability to, see research through to fruition. It doesn't have to be the number. Sometimes it can just be the quality of it. And personal statements, which to me was very reassuring and endearing, because there are those of us that read them, and I can tell you that I certainly do. And that and the hobbies and the things that make you a person, really trying to glean that before we decide who to spend an interview spot on, because they are very, very hard spots to come by, and we want to be judicious. We want that interview to really be somebody that has the chance to shine and fit into our personality, and I think that's where personal statements have the opportunity to explain parts of your application, to explain parts of you that matter, and to convince us why Rad Onc, and that it's not just about the hours or the pay or the perceived perks of the specialty. Post-interview interaction, if you get an interview and then afterwards, how do you do this? This is really tricky, really awkward, really difficult. There are some right answers and there are some wrong answers, and I would say for this, the key is there is a code of conduct. There's a code of conduct for program directors, essentially a contract that we sign when we participate in the NRMP. And we sign this contract, so to speak, or we agree to this code, that we will respect your right to privacy and confidentiality, which means I'm not going to ask you about your family planning. I'm not going to ask you where else you're applying. I'm not going to ask you, or for that matter, make my colleagues do it who are not program directors, but do it through some other means. The program director is responsible for any of the interviewers doing that to you. We're supposed to refrain from asking illegal or coercive questions. We're not supposed to require second visits or having to visit at all, you know, as a rotation. And we're supposed to discourage unnecessary post-interview communication. And actually, the title here is something that I came up with and co-authored with Abe Wu because Dr. Zeitman, Anthony Zeitman, invited Abe and I to write this. And the taking the game out of the match is basically trying to start a renaissance, if you will, amongst Rad Onc programs to once again remind ourselves of the oath, the code of conduct as program directors that we take. And by no means do we have it all figured out. By no means is everyone on their best behavior, but it is critically important that if somebody is asking questions, as was said here, that are inappropriate during the interview, there's absolutely guidelines for how you can report the violations. And this is something that you need to think about, you know, to what degree is it a violation, make sure it is one. You can look up what is and isn't if you're not sure. But this is truly anonymous and critical for keeping everyone honest. And I would encourage all of you to do that so that for the sake of our specialty, we can police those that are truly operating outside of the code. But you should know that those questions and that kind of behavior should not be allowed. And post-interview communication, I think if it's people, it's your home institution, or it's someone you've done research projects with because you got involved when you were away on an away rotation and you decided to continue a project. Obviously, with those folks, you don't stop talking to them after the interview. They're still your mentors. And you can talk to them, generally speaking, but you are not to be soliciting or in turn offering up information about where a program is on your list or trying to solicit where you are on theirs. And I think the best way to show interest in a program afterwards, certainly if you have questions, there's always a mechanism to ask genuine questions, and that often sends a signal to us that you really are thinking about the program. You're trying to understand how to compare this program to all the others. So after interviews are done, thoughtful questions, not just for the sake of asking them, but you know, that tell us that you're still thinking about the program. And certainly having a mentor pick up the phone for you and vouch for you with someone whom they know is not at all unreasonable. However, you want to be careful that you're not asking your mentor to call 10 programs on your behalf and telling each of them how much you love the place and giving impressions that are not genuine, because that's where people do talk. It's a small field. It's not working in your favor if you too thin. So you want to be judicious in who you have your mentors call and why. And I think outside of that, you know, certainly corresponding with the residents, if you have friends who are residents at a program you're interested in, there's nothing wrong with you know, asking them questions and making sure that that your interest in that program is understood. But again, it needs to be interest in a program, not I'm ranking you first and then expecting a response. And those of us that pledged to that commitment in the Red Journal, you know, when we don't respond, it's not that we're not interested. It's just that we set the rules that we're not supposed to be encouraging that kind of communication, because it's not fair to all the rest of you if we only correspond with those who contact us. So it's trying to really do this in the fairest way possible. There's no perfect way to do this, but I hope that helps. And finally, rank list, the most important factor in ranking candidates. Similarly to that survey, the top factors in selecting applicants to interview are not exactly the same as selecting the applicants to rank, because now we have met you, and even if it's just for 20 minutes or 30 minutes, the interactions during the interview, and I would be very careful from the moment you get there to the moment you leave, consider it an interview. We're not necessarily soliciting input from every single person you meet. In fact, I don't. But I will find that people come up to me and tell me their impressions, good or bad, of somebody, even if I never ask them. If the impression was good enough or bad enough, I'm likely to hear about it. So just be aware. Interactions during the entire interview day can matter. Interpersonal skills, which is a tough thing to measure, but nonetheless important. Rec letters stayed on the list. Research stayed on the list. And then, of course, again, the perceived interest in program. And again, this is tricky. We're telling you not to communicate with us afterwards because we can't communicate with you and it's not legal, et cetera, et cetera. But I do think your perceived interest in the program comes across a lot on the actual day of the interview. And that goes back to that sort of low energy, kind of weak handshake, lagging by the end of the day. If you're really into a program and you can't rally for that day, it's hard to later convince us that you're interested. And again, that's just some general advice for any interview. So I'll stop there. I hope that this was helpful so far.
All right, thank you for that great presentation. So if people have questions, you can go to our chat tab and send a question to staff, and we'll Dr. Vapiwala will take some questions, kind of let's see, try to generally answer them for everyone.
I think I see one here. Sorry, I'm trying to read these, but
Oh yeah, I can read them for you. So one of the questions was commenting on how to ask for letters of letters of recommendation from people you interview with or rotate with, or in general.
Yeah, that can be an awkward thing, or feel like it's an awkward thing. But believe me, if you're at a place that hosts away students, then you're at a place that is very accustomed to writing letters for those away students. We are used to that. We expect that if you're truly interested in the field, that by the end of the rotation, you'll be asking someone for a letter. And I think the best way to do it is obviously, if you have your 4 weeks there, ideally if you're at a rotation like ours where you have a primary attending you work with and then some secondary and tertiary folks, you spend enough time with the primary and secondary attendings that you can, by week 3, 3.5, ask for, obviously halfway through you might ask for feedback, continue to engage. We have a talk that you give at the end of the rotation. And so at some point in that 3rd or 4th week, it's reasonable to, make the decision about who you want to ask for that letter. If there's, there's always a course director, so if you can meet with the course director, perhaps ask him or her for advice. Sometimes the course directors like to write the letters and solicit input from all the faculty that you work with. So whatever the mechanism is, I think it's absolutely okay to inquire through the course director, and then depending on the process at that institution, go ahead and make the request. But I think the request ideally coming from you in the form of, first thanking them for the time that they've spent and the hopefully enjoyable rotation experience. I would hope if you're asking them for a letter that it went well. Framing it that way, and that this has genuinely solidified your interest in the field, and that you'd be honored if they would be willing to write a letter on your behalf, is usually sufficient. And then making it as easy as possible for them in terms of, once they agree, making sure they have the paperwork they need, your CV at hand in whatever format they want. I think that always helps.
All right, and so someone else had a question about how important is it presenting at ASTRO?
Presenting at ASTRO, yeah. I mean, there's so many meetings now that we're not sitting there saying, well, you got to have presented at ASTRO, or necessarily looking at the nature of the meeting. It's more about the project, and whether it was an oral or a poster, what have you. If you completed that project, or if it's a recent project, are working towards a manuscript, and whoever were your senior mentors on that, if one of them is a letter writer, and can speak to your involvement in the project, that goes far further to me than whether you presented an ASCO or ASCO GI or any of that. The advantage of being an ASTRO at least once as a student is, of course, networking and meeting folks, particularly if you're at a home institution that doesn't have a Rad Onc program. That's the greater advantage. But we're not too fussed about where you present it as long as it's a legitimate meeting.
Yeah, and also just a comment, like ASTRO is a nice place to see what is happening in radiation oncology to make sure that you're interested in the field, and it's a good experience in general for everything.
Sure, absolutely.
All right, so someone said, can you comment on fellowships and what what can be offered after residency for radiation oncology?
Absolutely. So in Canada, it has almost become commonplace that anyone graduating from the Canadian residency program essentially needs to do a fellowship, and that has a lot to do with their workforce issues and the relative dearth of jobs. In the U.S. at the present time, if you're trying to be in an urban center, where everyone else wants to be, at a large academic institution, and you're not willing to go into some of the regions of the U.S. that are relatively underserved in Rad Onc, then you may well find that faculty positions are not necessarily available when you graduate. And unfortunately, traditionally, that's been the reason that a lot of people do fellowships, is a sort of because of logistical, pragmatic reasons. The reality is that with the amount of skills that a Rad Onc needs, technically speaking, there are a lot of fellowships that one could do for truly self-improvement and training purposes rather than just to buy time. And the ones I'm thinking of are SBRT, proton fellowship, pediatrics, if you're particularly interested in that, brachytherapy. So there's reasons to do fellowships beyond that, but unfortunately, I think a lot of us still view it as people's motives in doing it often have to do with either trying to compensate for not having the greatest residency, training, or performance, or not quite getting the job you want and biding time. But it doesn't need to be that way. And I think there's an increasing number of fellowships becoming available, not just research fellowships, but true training fellowships. So, I would definitely, in the next 5 years, I think you'll see more and more of those, and I think some of our attitudes towards them will change for the better.
So I know we didn't cover this, but do you have any advice for people who are doing couples match, which is kind of, I think, increasing?
Yeah. It is an increasing. Every single year we have folks that are doing couples match, and every single year, it's a combination of anything from, the other partner is either doing internal medicine or pediatrics, which, relatively speaking, may be easier to match in, but if you're trying to be at a top institute for Rad Onc, a lot of times their internal medicine and their pediatrics programs are also relatively competitive. But I do find that just the sheer number of internal medicine and pediatric spots makes that kind of couples match a little bit easier, and it is not uncommon for applicants that once they receive an interview invitation. So obviously in your electronic residency application you're going to note couples match or not. But once you are invited to interview, it's not unreasonable to remind or make the program aware, through email correspondence or what have you, that your significant other is also, couples matching, and that you'll be visiting together or what have you, because the program directors talk. So if I am interested in somebody, we've invited them for an interview, and I know that he or she is couples matching, I will contact the program director of that program, and I'm thinking of some of the more competitive ones. We get a lot of sort of Rad Onc Derm, Rad Onc Ophtho, Rad Onc ENT, what have you. So a lot of those times, we can be in touch and sort of weigh in with each other. Hey, look, this is the person we're looking at. What do you think of his or her partner? And we're not going to share that with you guys, but a lot of that happens behind the scenes. So I think when you come to interview in some non-obnoxious way, you do need to kind of remind and keep that at the forefront of our minds, because that does take an extra step. And it's not that we're not willing to do it, but it is extra work for the program directors to coordinate, because neither program wants to put people high on their rank list if the partner has no chance. So hopefully most of you that are couples matching are both in specialties where you're appropriately applying and appropriately equally competitive. But I think there are ways to make sure that that is known, and looking in all of the programs in a given city that you're both willing to live in is critical. Just sounds obvious, but do not ever try to just only be at the same institution. I mean, apply, and if one of you gets an interview and the other one doesn't, obviously you want to apply at every program within 20, 30 miles of your partner's program, because a lot of times that's really the only way the couples match works. It's not necessarily the same institution, but at least maybe you'll end up in the same city. And you need to make your rank list with that in mind, of course.
All right, and if you have any questions also, you can email me. I did a couples match, and I mean, all Dr. Vapiwala's advice is very good, but if you have any questions, you can always email me. I think that's it for all the questions for right now, but we appreciate Dr. Vapiwala for spending her time today. We will try to answer some more questions that we have a little bit later, and we will post all this online. You will see it on the ACRO website as well as SDN, but we appreciate everything, and thank you again, Dr. Vapiwala.
Thank you. Thank you so much for inviting, and again for everyone for tuning in. I hope it was helpful. And good luck. Best of luck to you.